Hi class, my name is Andrea Hickey and I am going to be discussing multiple sclerosis. Multiple sclerosis, by definition, is a chronic disease of the central nervous system marked by damage to the myelin sheath. Plaque occurs in the brain and spinal cord causing tremor, weakness, incoordination, paresthesia, and disturbances in vision and speech. So what is multiple sclerosis, or MS? MS is a disease that primarily affects the brain and spinal cord, which is known as the central nervous system, or CNS. The CNS controls everything that we do, whether that be taking a step or trying to remember all the tasks that we need to do for the day. The exact cause of MS is currently unknown, but what we do know is that something initiates the immune system to attack the brain and spinal cord. The damage caused by the destruction of the myelin, which insulates wire-like nerve fibers, disrupts the nerve impulses to and from the brain. This interruption of communication signals causes unpredictable symptoms or loss of function. Although there are unknown causes, it is believed that environmental factors and genetic predisposition influence this disease. What are the possible symptoms? MS symptoms vary between individuals and are unpredictable. Any or all of these symptoms are possible in MS, depending on where in the CNS damage to the myelin sheath has occurred. Physical symptoms include fatigue, which is most common, spasms, atrophy, problems swallowing, blurred or complete loss of vision, issues with gait, which has to do with walking, balance and coordination problems, as well as loss of bladder control. Cognitive symptoms include slurring of speech, loss of memory, and difficulty concentrating. Also, emotional symptoms, which include depression, mood swings, and anxiety. What are the types of MS? Well, the first one is clinically isolated syndrome. It is the first episode of neurologic symptoms which is caused by inflammation and demyelation in the CNS. This episode, which is by definition must last at least 24 hours, is characterized of multiple sclerosis, but does not yet meet the criteria for a diagnosis of MS because people who experience a CIS may or may not go to develop MS. Next is relapsing remitting MS, which is the most common disease course, and it is characterized by clearly defined attacks of new or increasing neurologic symptoms. These attacks, also called relapses, are followed by periods of partial or complete recovery, meaning all symptoms may disappear or some may continue to become permanent. Next is secondary progressive MS. Most people who are diagnosed with relapsing remitting MS will eventually fall into a secondary progressive course in which there is a worsening of loss of function over time. Lastly, primary progressive MS is characterized by worsening neurologic function from the onset of symptoms without early relapses or remission. Also, MS can be difficult to diagnose, but once diagnosis is confirmed, there are disease-modifying therapies for reducing attacks and can slow down the damage. So how do we treat MS? Medications are used in MS to modify the disease course and treat relapses and manage symptoms. Medications used for MS in this picture are given sublingual, meaning through the mouth, intramuscular, and intravenously. There are also medications that are specific to symptoms that occur in MS. Studies have shown that people who exercise with MS can help decrease fatigue, depression, improve strength, and result increased participation in social activities. Inactivity in people with or without MS can result in many other risk factors. Lack of exercise can lead to weakness of muscles, decreased bone density, which causes osteoporosis and can lead to an increased risk of fracture, and also have shallow, inefficient breathing. So, what's the take-home message? Recognize signs of your body telling you something is wrong. Regularly exercise, have a healthy diet, and most importantly, take your health serious. Thank you, and I hope you enjoyed watching this video.